Kristen, thank you. First Alert Safety Desk now an alert to parents about the risks of vaping, your child's mental health. Aisha, you're learning how kids and teens are coping with stress and anxiety.
Right, Tammy, just getting this from the Wisconsin Office of Children's Mental Health. It says vapes these days are even more potent, and young people are especially vulnerable to addiction. We now know more than a third of Wisconsin high school students have tried vaping. We've done countless stories on this, but this is a renewed call to action by parents, caregivers, and policymakers. One idea is to raise Wisconsin's tobacco and vape sales age to 21 and increase taxes on vaping products. Health officials want to raise awareness, saying teens often try vaping thinking it will help relieve stress, but it can actually worsen anxiety, depression, and those stress levels. That includes the withdrawal symptoms. Another concern today is vaping products that resemble things like smartphones, lip gloss, and gaming devices. Parents, Children's Mental Health says you can have those short, open conversations with your child about vaping and quick ways to turn it down. And this new fact sheet adds nearly 90% of adults who smoke cigarettes on a daily basis started their habit before they were 18. Nicotine goes directly to the brain, and experts say vaping can also worsen sleep and come with a higher risk for suicide. And this fact sheet even includes those tips for teachers and healthcare providers, not to mention policymakers. So we're working to get all of that linked for you under the Safety Desk tab at WVOY.com.